Hi, my name is Mudhoni Monica. I'm a BSN RN RH practitioner. Today I'm going to talk about yeast infection. 3 out of 4 women or people with vaginas will get a yeast infection in their lifetime. 50% of those with vaginas will get more than one episode of a yeast infection in their lifetime. So what is this yeast infection? 85 to 90% of the yeast infection is caused by Candida albicans. Our vaginas harbor a healthy bacteria in them. These healthy bacteria live in harmony and they cohabit in harmony. But when the pH is disrupted for one reason or another, then one bacteria either is reduced, and if one bacteria is reduced, then of course another one increases. So when one increases, what happens? They get into the deeper layers of our vaginas and they start causing symptoms. The signs and symptoms of the yeast infections are: once the Candida albicans now increase in number and they invade the deeper layers of our vaginas, we will start experiencing a discharge, a Candida-like discharge, white discharge that is cheese-like. Then there is itchy, very itchy. The vagina is very itchy. There is redness and there is sometimes pain during intercourse. So you will develop the cardinal signs of inflammation. How do we diagnose Candida or candidiasis or the yeast infection? Your practitioner will take history from you. So they will take the history and hear from you the signs and symptoms. We will also do a physical examination where we want to look at the redness, we want to look at the kind of discharge that is coming out of the vagina, and we can also do a lab investigation to find out the exact microorganism that is increased in the body. So we treat the yeast infection with either a cream or a pill. The cream is applied in the vagina or is inserted into the vagina, or you can take a pill. So how do we prevent the Candida or the candidiasis or the yeast infection? Now, the reasons that the pH will be disrupted in the vagina is what that we are going to look at. Intake or when one takes antibiotics, what happens? The lactobacilli bacteria reduces. So when the lactobacilli bacteria is killed and is reduces, so what happens? The candidiasis increase in number, and that is when we start getting the symptoms. So let us avoid taking antibiotics over the counter without a prescription. Again, the atmosphere that is nice for Candida albicans to grow is a warm, moist environment. Our vaginas are warm and moist. So if you increase the warmness and the moistness, then this is going to increase the growth of the Candida albicans, and this will cause the symptoms. So let us avoid keeping our vaginas so warm and so moist. So at night when you're sleeping, you don't need the panties. Let your vaginas breathe. The other thing that we need to do to avoid our vaginas getting moist, if you're going to a swimming, once you have finished your swimming session, make sure you remove your bathing suit, because your bathing suit is making your vagina wet and warm, and so increasing the candidiasis in the vagina. Wearing of other materials made panties. Let us wear cotton panties, because cotton panties will absorb moisture and they are breathable. So our vaginas will breathe, there is no moisture, and the temperature will be controlled. The other panties are cute, yes, I believe that, and I trust that, and I know that. But you need to avoid them to make your vagina happy. The pads, or the kind of pads that we use, we need to use breathable, absorbable kind of pads. Because if we use pads that are not breathable or they are not absorbent very well, what happens? We are going to make our vaginas wet, and we are going to increase the temperature. And you know very well, blood is a very good medium of bacterial growth. So when we increase the bacterial growth, then our vaginas are not going to be very happy. So we can avoid this. When we are visiting the toilets again, if you're going to visit a public toilet, make sure you flush the toilet before you use the toilet. And if you can't flush the toilet for one reason or another, make sure you lay tissue on the toilet before you urinate, because when you urinate again, you're going to splash the urine that was in the toilet, the basin toilet, and you don't know what it contains. Once we urinate as women, it is very important to wipe correctly. We are wiping from front to back. We are not wiping from back to front, because if we wipe from back to front, we are going to bring the bacteria from the anus to the vagina, of which is going to throw off the pH of the vagina, causing increase in either microorganism, causing the symptoms. Candidiasis is not sexually transmitted. Yeast infection is a reproductive tract infection. Although once you're having sex, the semen and the sperms are a base. So what happens once you're having sex? It can throw the pH of the vagina off, that making the yeast grow, though it is not sexually transmitted. So let us prevent the yeast infection. Let us use the right pads, let us use the right pants, and let our vaginas breathe, because they need to breathe. Thank you very much.